In any confrontation, there is one battle that is constantly fought, the one to save lives. To win this fight, the SAF has a comprehensive evacuation and treatment system that ensures its combatants receive timely and effective medical care. It is a painfully simple truth. A soldier who falls in battle with a bad injury needs prompt medical attention in order to survive. On the ground, the casualty has medical help ready at hand. But if surgery is required, timely evacuation to a surgical facility is critical for his survival.
I think one of the biggest challenges really is to keep the military casualty alive and stable all the way from the site of injury all the way back to the base hospitals where they are able to receive definitive medical and surgical care. And this extension of the golden hour is critical as it would allow us to maximize the chances of survival for each one of these casualties.
With this in mind, the Singapore Armed Forces Medical Corps joined forces with personnel from the Ministry of Health in a recent exercise to test the planning, coordinating and executing of casualty evacuation and management during operations. Since 1990, this exercise has been conducted about once every 3 years. It puts into practice the sharing of information among the different echelons of the SAF Medical Corps and the MOH in evacuation and management of casualties. The basic evacuation chain appears straightforward. The challenge is to keep every single link strong. Out on the battlefield, the buddy and platoon medic are the first to attend to the wounded soldier. Once stabilized, the injured is evacuated to the casualty collection point and then to the battalion casualty station where the medical officer reassesses him and renders more treatment. If required, he's brought to the medical company and then to the Combat Support Hospital or CSH, where damage control surgery can be performed.
The Combat Support Hospital is a mini-field hospital that is used to support our troops in the battlefield. Essentially, we receive casualties, we sustain their lives, we perform life-saving and limb-saving surgery, and then we push them out through air evacuation or land evacuation to our base hospitals.
The vast majority of our soldiers may be quite far away from medical care that we understand it. And so the idea of having a combat surgical hospital is to be able to push these capabilities all the way forward, as far forward as we possibly can, to attempt to deliver some of that care. And so when you are a casualty and you come into our combat surgical hospital, you expect to receive emergency care up to the same level that is practiced in hospitals, major hospitals such as Tan Tock Seng and SGH.
The CSH is staffed entirely by NS men. Many of these surgeons, anesthetists and doctors are senior and renowned specialists in the public and private sector. They work as a team with trained NS men medics who keep their skills sharp and relevant with every in-camp training.
In terms of training, I think it's generally quite demanding because there'll be a lot of new equipment, new protocol for us to keep us updated. And it can be quite a challenge to go through some procedures, but we have MOs who are very forthcoming in helping us out in this in terms of procedures and treatment to be rendered to casualties.
This year's exercise saw the introduction of operational medical centres in the casualty evacuation network. This is a typical medical centre in a camp. In time of need, it transforms into an operational medical centre to receive casualties and provide emergency first aid. The largely NSF staff of the medical centre will be augmented with a medical company made up of NS men.
There will also be an increase in the number of doctors stationed here. So we'll be getting increased number of resuscitation equipment. Okay, this will allow us to treat greater number and volume at greater speed during operational scenario.
Once stabilized, casualties who need further medical care are rapidly evacuated to a tertiary hospital for definitive surgery. To further boost the survivability of injured servicemen, air assets like the Super Puma helicopter can be deployed to carry out heliborne medical evacuation or HEME operations when required by the Army Medical Services. The HEME team consists of a HEME medical officer and a HEME medic who are trained in advanced cardiac as well as trauma life support. They are equipped with the AML-SU2, which allows them to perform life-saving medical interventions if there's any deterioration of the patient on board on the way to the hospital.
This is a set of ruggedized, compact and a portable suite of equipment. It includes a clinical monitor, which then allows the HEME team to closely monitor the patient's vital parameters such as blood pressure as well as oxygen saturation. And if there's any deterioration, they are then able to respond immediately. Similarly, if the patient were to collapse in flight, then they have a set of resuscitative equipment here, and this includes the defibrillator as well as the ventilator. And by using this equipment, they will be able to successfully carry out their resuscitative procedures.
On arrival, hospital staff take over the medical care of the casualties. A hospital military casualty administration team based at the hospital monitors the status of military casualties.
So our role basically in the hospital is to work together with the hospital staff and validate our processes with them and to make sure that we look after and manage all the SAF casualties in time of operations.
The exercise provided an invaluable opportunity for the SAF Medical Corps to strengthen links with external medical agencies.
I've gotten to work with a number of people from various number of agencies, and indeed it has been quite challenging and quite exciting coordinating the responses and coordinating planning among all these different people, each with their own various objectives and sub-objectives for this exercise.
It's good for them to meet each other and then creating the refresh the network as well as iron out some of the procedure, because over time there may be changes and so forth.
With cutting-edge equipment and well-planned processes in place, it is the commitment and dedication of the SAF Medical Corps to saving lives that will make the difference in time of need.
By conducting our duties purposefully and professionally, we are able to improve the overall survivability of our soldiers secondary to combat. And this has an immeasurable impact on our combatants' morale and fighting spirit.
For every soldier, knowing that there are medics, there are doctors trained and qualified to treat them if they should be injured, I think will give them a peace of mind when they are deployed during times of crisis.
That's all we have for you on this edition of Defence Watch. For more videos, log on to www.youtube.com/cyberpioneertv. You can also check out the May edition of Pioneer magazine or log on to www.mindef.gov.sg/cyberpioneer for the latest events news. I'm Carissa Seat. Thanks for joining me.